Lawrence Lustig. I am the Howard Smith Chair of Otolaryngology and Head and Neck Surgery at Columbia University, New York Presbyterian Hospital. You're listening to Interview with the Surgeon Agent.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Dr. Lawrence Lustig, Chair of Otolaryngology, Head and Neck Surgery at Columbia. Doc, how are we doing today?
Doing great here in New York.
Thanks for being with us. So let's just jump right into it. What were your goals and aspirations during your residency, and how did those change during your fellowship?
Well, my number one goal during residency was getting really strong clinical training and surgical training in otolaryngology and head and neck surgery, and making sure I had the tools to be successful in my future career. Also, it was an opportunity to network with a bunch of fellow residents as well as attendings, but also to get really good research experience that I would then take into my fellowship.
So going through that fellowship year, can you kind of tell us about your mentality heading into your first job search and how that perspective changed in the beginning years of your career?
So my fellowship was at Johns Hopkins, and I chose that particular fellowship because they really offered not just great clinical training, but really good research mentorship. I had an amazing research mentorship in the lab of Paul Fuchs. It was a really in-depth exposure that allowed me to develop some initial projects that I would then ultimately take on in my first job. I ended up staying at Johns Hopkins in the early part of my career, and being able to develop your research program in the same location where you ended up with your first job, that was it was a huge advantage because I didn't lose any time. I could go immediately into grant writing mode and start working on getting those important early grants to get my career going.
So what would you say were some of the keys to your success that shaped your early career as you climbed the top of your industry?
Well, I think the most important thing are finding really great mentors, because as much as you think you don't know nearly as much as you need to. And so finding the right mentors to show you how to get things done, to provide really good role models in terms of how to get things done, that's absolutely critical. And that's no matter what you're doing. Really, I think that's important in any industry, in any field of medicine. And it could be research mentors, it could be surgical mentors, it could be sort of academic mentors to help you navigate the complexities of an academic career. And even if you're going into private practice, finding good mentors that you can maintain, just to people to call when you run into problems. You're stuck in the operating room, you've got a challenging problem in front of you, you're not sure what to do. Call your old researcher, call your old surgical mentor, get their opinion. And mentors love to be called upon. It's a great compliment.
So on that train of thought, did you ever consider going private practice, or are you academic focused all the way?
I was academic focused all the way. I think, I think there's a certain mindset that you like to be challenged every day with new clinical problems that are challenging, that require a team approach that it's hard to do in private practice. When you're talking about skull-based surgery, for example, you can do it in private practice, but it's challenging. Because there's some late nights at the hospital, there are sick patients, there's complex issues that arise. But when you've got a team that's dealing with this, it diffuses the care and allows you, I think, take care of these people in a way that's just harder to do in private practice.
What advice do you have for the graduating residents and fellows entering the professional job market for the first time?
Well, I think my number one piece of advice is just, number one, be honest with yourself. Really make sure that the path you've chosen is the one that's right for you. There are a number of people who really want to be think they want to be in an academic environment when they realize that it's not what it's cut out to be, in terms of there's all these pressures. You want to be able to work within a team and a large unit, and you've got to be able to sort of navigate some of those complex relationships. Alternatively, there's people who feel like they wanted to go into private practice, but when they get there, they sort of miss the academic environment. So I think number one, just be honest with yourself what it is you want out of your career. Number two, be willing to change. just because you land in one spot for your first job doesn't mean that's where you need to spend the rest of your career. It's never too late to make a change. The sooner you realize that where you're at may not be the right location, start looking around. Start looking for new positions. I've been, I'd say, fortunate enough that I've made a number of changes in my career at different medical centers, and every time I've made a change, it's been frightening and scary, but at the same time, huge growth opportunities. And I've always looked back and been thankful not only where I am, but where I ended up.
What type of mistakes do you see young surgeons making?
So I can't really comment private practice because I don't have a lot of experience, but I would say that I think the number one biggest mistake I see for junior faculty when they're entering an academic environment is that they're so hungry to want to be the surgical guru or the clinical guru that gets busy so quickly that you quickly don't have time to develop your academic focus, right? So advancing within an academic environment, you need to be not just clinically and surgically competent, but you need to have a good academic research to your name as well. It's not necessary that it could be an educational focus. It could be, perhaps a research focus, but really taking the time to make sure you devote enough of your early career to whatever it is that's going to allow you to succeed in academics. That's really important. If you focus on just one leg of that three-legged stool, the other two tend to suffer if you don't attend to it early enough.
With a lot of these conferences being done virtually now, what advice do you have for the graduating class regarding their networking and outreach process?
No, I think on the one hand, it's stressful and it's harder because you don't get that in-person one-on-one opportunity to sit down and just chew the fat with people, and that nothing replaces that. But at the same time, I think there are a lot of opportunities to outreach and network, given the fact that everybody's on Zoom. It's not that hard to set up a Zoom meeting with anybody at any time of day these days. You don't have to be there physically to do that, and it's so much more acceptable now because we're all doing it. Again, I think the quality of those interactions aren't as deep, but at the same time, it's all we've got right now, and you should take advantage of the fact that we are all on Zoom and other electronic media like WebEx and other outlets. Yeah, I think the most important thing is when you wake up in the morning, you should be excited about your job. We all work hard. We all put in long hours. Doesn't matter if you're in private practice or in academics, but you should be excited to get out of bed every morning and go to your job and do your work and treat patients and do research and do whatever it is that motivates you in it. And if you find that you're not happy in what you're doing, it's time to really rethink what you're doing and, maybe make the jump from academics to private practice or vice versa, or jettison the research or start doing some research, but try to figure whatever it is that makes you excited about waking up in the morning, and you'll have a great career no matter what you do.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.